Welcome, SCI team. Today's session on series number 7 centers on a fundamental and life-saving practice: the proper use of personal protective equipment, or PPE. As frontline caregivers, the responsibility to prevent infections lies significantly in our hands. This presentation will explore how consistent and correct PPE use directly impacts our veterans' safety and our own well-being, including that of our families at home. The goal is to shift from a mindset of mere compliance to one of culture and advocacy, where safety is the norm, not the exception. Our veterans face heightened health vulnerabilities, and our vigilance can be the difference between recovery and adverse event. My name is Michael J. Orellano, your SCI nurse educator. This session will equip everyone with essential knowledge and reinforce that by caring for others, we also safeguard ourselves. Let's embody the VA's commitment to a culture of safety, integrity, and excellence in every encounter. This session has 3 important objectives that will guide our discussion. First, we will establish a clear understanding of why PPE is particularly critical in spinal cord injury care. SCI patients are at increased risk of infections due to factors like immobility and catheter use, making protection strategies essential. Second, we will discuss how to use PPE correctly and recognize common errors, such as improper donning and doffing, which could compromise safety. Finally, the knowledge gained here will be applied not only in the care of veterans, but also to protect personal and family health. The COVID-19 pandemic has highlighted the ripple effect of PPE adherence across all settings. Mastering these principles empowers staff, protects loved ones, and enhances the quality of care. By focusing on these goals, we can collectively strengthen our safety practices and minimize health risks in and out of our workplace. SCI patients present unique infection control challenges due to their increased susceptibility to urinary tract infections, pressure injuries, and respiratory complications. Their immobility and frequent need for invasive procedures make infection prevention strategies critical. As healthcare providers, our actions can either block or facilitate the spread of pathogens. Proper PPE use positions staff as the first and most important line of defense. Every glove, mask, and gown used correctly serves as a barrier that can stop bacteria or viruses in their tracks. This protection does not end at the hospital door. The same microorganisms we prevent at work can otherwise reach our families and communities if protocols are ignored. Cross-contamination can happen easily if vigilance slips, so PPE adherence is key to protecting both veterans and loved ones. Infection control isn't optional, it is a professional duty and ethical obligation. Understanding the types and uses of PPE is foundational to proper infection control. Gloves should always be worn during patient care or when touching bodily fluids or surfaces. They must be changed between tasks and removed correctly to avoid cross-contamination. Masks and face shields are vital for preventing exposure to airborne or droplet pathogens, such as influenza or respiratory viruses. During outbreaks or flu season, these are essential protective tools. Gowns protect uniforms and skin from exposure to body fluids, particularly in isolation or wound care situations. Each piece of PPE plays a specific role in our infection prevention system. Selection and use should be based on the level and type of exposure anticipated. Incorrect use can render PPE ineffective. Studies have shown that consistent, correct use of PPE significantly reduces the incidence of hospital-acquired infections and improves patient outcomes. Despite best intentions, common PPE mistakes can compromise both staff and patient safety. One frequent error is reusing disposable PPE. Single-use items, like masks and gloves, lose their effectiveness after one use and can become sources of contamination. Another mistake is touching the face while wearing gloves. This action transfers bacteria and viruses from contaminated surfaces directly to mucous membranes, elevating infection risk. The most hazardous errors often involve donning and doffing PPE in the wrong sequence. Improper removal, especially without hand hygiene, increases the chance of self-contamination. According to the CDC, incorrect doffing is one of the leading contributors to healthcare worker infections during outbreaks. Ongoing training, regular audits, and peer support are effective tools in mitigating these errors. Awareness and accountability are key to sustaining a culture of safety and protecting everyone in our care continuum. In our SCI unit, Proper PPE protocol is not only a requirement but a critical safeguard. CDC and VA guidelines provide evidence-based standards to minimize the spread of infections. These protocols state that donning must occur before entering a patient's room or contaminated zone, while doffing should be done before exiting to prevent environmental contamination. Disposal must be immediate and appropriate, using designated biohazard bins. Delays or improper disposal lead to surface contamination and potential spread. These practices are especially important in CI care, where patients are at high risk for infections such as C. diff and MRSA. Reinforcement through visual signage, PPE stations, and leadership rounding ensures adherence. Staff must not treat PPE as routine or secondary. Instead, it must be viewed as a protective tool integral to care quality. When used correctly, PPE not only protects but also communicates a commitment to excellence and safety. The responsibility of infection control extends beyond our veterans and into our own households. It is essential to understand how workplace pathogens can travel home through uniforms, bags, and unwashed hands. Following proper uniform separation policies, such as changing before leaving work and laundering uniforms separately from household clothes, can reduce transmission. PPE should never be taken out of the facility or reused outside protocol. Hand hygiene before leaving the unit is non-negotiable. These small practices make a large difference. A study emphasized that consistent PPE use and decontamination habits at work correlated with lower illness rates in healthcare workers' families. When staff prioritize safety at work, it protects communities. Education on these practices and peer reminders can reinforce these behaviors. Protecting our loved ones is as vital as protecting veterans. Safety is not confined to our unit. It is a continuous lifestyle of vigilance and responsibility. Safety is not confined to our unit. It is a continuous lifestyle of vigilance and responsibility. To conclude, the effective use of PPE is not just a matter of compliance, but a statement about our culture and values. Within the SCI unit, there is an opportunity to lead by example and elevate standards of care. Veterans depend on our consistent actions to stay protected. By viewing PPE as an essential part of our daily responsibilities, we champion a culture of prevention, dignity, and safety. We are not only caregivers, we are safety leaders and advocates. This mindset must permeate every interaction and every shift. Let's commit to peer coaching, feedback, and continuous learning. By staying current and engaged, we ensure that our actions align with best practices. Let's protect one another, our veterans, and the communities we return to at the end of each shift. Together, we can uphold the highest standards and make a meaningful difference in health outcomes. This presentation was developed using the most current evidence-based literature on spinal cord injury related to the use of PPE. Each reference listed supports a key aspect of SCI nursing care, including pathophysiology, assessment, prevention strategies, and emergency management. These sources ensure the accuracy and credibility of the strategies presented today, aligning with best practices and promoting excellence in spinal cord injury rehabilitation and nursing leadership. Thank you all for dedicating time to this important presentation. Your attentiveness and commitment to safety are the foundation of our high-quality care. Remember, the use of PPE is more than a policy. It is a reflection of our respect for veterans, colleagues, and families. Every glove, gown, or mask worn correctly is an act of compassion and professionalism. Let's not allow complacency to threaten the safety culture we have built. Keep encouraging one another, continue refining best practices, and uphold the highest standards in every patient interaction. The SCI team is uniquely positioned to lead in infection prevention, and your daily commitment ensures veterans receive the safest care possible. Let's carry this message forward and continue making a meaningful difference. Together, we lead with purpose, and together, we ensure a safer tomorrow. Again, thank you very much.